Welcome to Week 9 of Pharmacology for Vocational Nursing 1. This lecture is a little long, and so it will be divided into sections. We will be discussing some of the enteral and parenteral supplements, their mechanism of action, cautions, contraindications, routes of administration, potential drug interactions, adverse effects, potential complications associated with enteral and parenteral supplements, some lab values, and then finally some of the nursing implications associated with nutritional supplements. So let's get started. From your nutrition course, or HO15, depending on where you took it, you might recall that nutritional supplements are dietary products used to provide nutritional support. So these can be given in a variety of ways. We've probably all taken a nutritional supplement at some point in our life, but what we're going to look at today are those types of formulas that we will give enterally or parenterally, varying in their amounts and complexity, the carbohydrates, the proteins, the fats, the electrolytes, vitamins, minerals, as well as the osmolality can be affected. So the variations in these amounts and the complexity of the formula are based on the patient's diagnoses, the needs that they have calorically, as well as based on the contents, lab values for the individual patient, with the purpose of the nutritional supplementation being the treatment of malnutrition. It can be a generalized malnutrition or a particular deficit, and thus there's a need for individualized formulation. Malnutrition is the body's nutritional needs are not being met by the nutrient intake. So intake doesn't meet the demand. This can be due to an overall lack of intake, simply not taking in enough calories or nutrients, or not being able to take in enough calories or nutrients based on this higher demand that the patient has as a result of an illness or injury. Enteral nutrition is the provision of food or nutrients through the GI tract, with parenteral nutrition being the delivery of nutrients directly into the circulation by means of an intravenous solution. As the name implies, the nutritional supplement is classified by the means of delivery. So enteral nutrition is that through the GI tract. Oral consumption is the most common and the least invasive route. So if at all possible, we have the patient drink, the shake. However, sometimes that's not an option for us. So feeding tubes through the various routes can be used for enteral nutrition. There's a table in your textbook, Table 55.1, that gives the types of tube feedings of feeding tubes and a concise description of each. So I advise you to look at that, check that table out. When we're talking about enteral nutrition, we use feeding tubes for those patients that have maybe an abnormal esophageal or stomach peristalsis. Perhaps there's an altered anatomy secondary to a surgery or depressed consciousness, also impaired digestive capacity. While this is not a complete list, this just gives you an idea of some of the reasons that we may have a feeding tube placed. The enteral route is considered superior for nutritional supplement, and because we know that the parenteral route is more direct, that seems a little bit odd to us. But when we think about the enteral route, there are far less risk of septic complications or metabolic complications. It is the most like digestion. So when we look at the enteral formulation groups, we know that these provide basic building blocks for anabolism. They supply complete dietary needs through the GI tract by an oral route or by the feeding tube. There are approximately 100 different enteral supplemental formulas available, so it obviously would be impossible to cover all of them here, but we're going to discuss the types. The supplements are categorized based on the characteristics of the individual formula. The basic categories are elemental, polymeric, modular. These are carbohydrate, fat, or protein formulations, our altered amino acid formulations, and then those for impaired glucose tolerance. We're going to cover these broad categories briefly, and then we'll review some examples as well. So our first group in the enteral formulation group is the elemental. Peptamen, Vital HN, Vivanex Plus, Vivanex 10. These solutions contain hydrolyzed proteins such as dipeptides, tripeptides, or crystalline amino acids, along with glucose, oligosaccharides, and either vegetable oil or a medium chain triglyceride. So they have no significant fat content. Because of this, minimal digestion is needed and there's very little residual left in the gut. This is why we call them elemental formulas. Their macronutrients are in the most elemental form. They're used for malabsorption, partial bowel obstruction, irritable bowel disease, or other conditions affecting the GI tract or the colon. They're particularly useful in patients with malabsorption due to pancreatic insufficiency or limited fat absorption, obviously, because they have no fat in them, right? So one of the issues with the elementals is that their hyperosmolarity of these formulas can cause some GI problems. They're extremely hypertonic, and this often results in severe diarrhea. The use of elemental formulas are typically limited to patients who cannot tolerate isotonic solutions. Our polymeric formulas, these are the ones that you may be familiar with, are Complete, Ensure, Ensure Plus, Isocal, Osmolite, Portagen, Jevity, Sustacal. These are preferred over elemental formulations for patients with fully functional GI tracts and those that don't need specialized nutrient requirements because they cause fewer GI problems. They most closely resemble our normal dietary intake, and they may or may not have fiber added. These are frequently referred to as complete formulas. Our modular formulas in the enteral formulation group are broken into three basic types. Carbohydrate, you may hear Moducal or Polykos. Fat, MCT oil or microlipid. And protein, Casec or Promod. Promod's probably the most popular. Propac or Strestine. There are some vitamin and mineral formulations as well, Nutrisource vitamins or Nutrisource minerals. These are single nutrient formulas. They're intended for use with monometric or polymetric formulations. So when we think about these formulas, just remember that modular formulas are considered incomplete. They're intended not to be used alone. They're intended to be used with complete solutions for patients who have unusual requirements or to design a solution that may not be available commercially. Now, our enteral formulation group called the altered amino acids are typically or frequently referred to as disease-specific formulas. And these are aminide aid, hepatic aid, travosorbrenal, trauma aid, HBC. You may be more familiar with the respiratory failure form, that's Pulmicare or Nutrivent. And they contain varying amounts of specific amino acids. As I said, these are referred to frequently as disease-specific formulas because they're used for patients with diseases that are associated with a particular altered metabolism capability. And so that amino acid is concentrated, so to speak. Interestingly enough, although they're used frequently, the most recent research indicates they're not necessarily superior to standard formulas, with the exception of the next category, and that's the category of our impaired glucose tolerance. Now, Glucerna is not by any means the only one, but our impaired glucose tolerance formulas contain proteins, carbohydrates, fats, sodium, and potassium. But they are specifically designed for use in patients with impaired glucose tolerance, for example, our diabetic patients. So enteral nutrition interactions can occur, various nutrients can interact with drugs to produce a food-drug interaction. It's the same nutrient, the supplement, that would cause the interaction if you had taken that into a whole food. So when you think about that, remember that if you had a food-drug interaction, if that component is in the supplement, then you're going to have the same food-drug interaction. Enteral nutrition can delay absorption of some medications, as usually food delays absorption of medications when given simultaneously. So this is, again, just the same thing occurring, only it's with enteral nutrition as opposed with food. Enteral nutrition can inactivate some medications. For example, we don't give tetracycline with milk, right? Because we don't give tetracycline with any formula, anything that contains calcium. So a nutrient formulation that contains calcium, we wouldn't give that. Quinolones, same thing. Another example would be Dilantin, phenytoin. We hold tube feedings 2 hours before and 2 hours after the administration of Dilantin, because if we don't, it's not absorbed, and then the patient ends up having seizure because they don't have a therapeutic Dilantin level. So the adverse effects, gastrointestinal intolerance is a big one, with the most common being diarrhea. Dumping syndrome can occur with bolus feedings. Our enteral solutions are often given via continuous infusion for this very reason. Isotonic solutions are usually initiated at a full strength, but hypertonic solutions are almost always initiated at half strength. The strength and the rate of the infusion are then advanced every 6 to 12 hours, depending on patient's tolerance. Minor complications of tube feedings occur in 10 to 15% of the patients, and mechanical complications are not considered minor complications, though, because they are potentially more serious. Aspiration pneumonia is a mechanical complication, and it is of particular importance. All patients receiving NG tubes are at risk for this life-threatening complication. Nasogastric tube feedings ideally would be limited to patients who can adequately protect their airway. So the risk is exponential in those who are compromised either in their mobility, their level of consciousness, or if they have an impaired gag reflex. Metabolic complications during enteral nutritional support are pretty common, but in most cases, these are easily managed. The most important one of those is hypernatremic dehydration. We most commonly see this in elderly patients that are being given excessive protein intake, but they're unable to respond to thirst. So we can also see abnormalities of potassium, glucose, carbon dioxide production, and acid-base balance. So those are all things that you're going to want to watch and monitor for in your patient. Contraindications for almost all supplements will include a known allergy to a particular formula or to a component of the formula, or any type of a genetic disease that renders the patient unable to metabolize a particular nutrient, such as a G6PD deficiency. So I'm going to stop here with this recording. You'll pick up on slide 14 and we'll move on. So take a quick break and I'll see you in a few minutes.